there are a million reasons to get a second opinion, all of which are correct. If you have any question, if you want to make sure that the decisions that you are taking that can be life-changing decisions are correct, a second opinion is in order.
This is the James Cancer-Free World podcast. I'm Steve Wartenberg, and my guest is Dr. Ricardo Carrau. Ricardo is a James head and neck cancer surgeon, and he is the director of the Comprehensive Skull Base Surgery Program. Ricardo will fill us in on the new James Online Second Opinion Program and how cancer patients anywhere can connect with a James doctor who specializes in the type of cancer they have to confirm their original diagnosis, to help them make all important treatment decisions, and explore and learn about treatment options and clinical trials that may not be available where they live. But first, using the complexities of diagnosing and treating head and neck cancer as a starting point, Ricardo will talk about the basics of a cancer diagnosis, second opinions, and why they are important, the process, and how they can lead to better outcomes for patients, which is always the goal. Welcome to the podcast.
Thank you, Steve. Thank you for hosting me. I look forward to the conversation.
Yes, I think this is going to be very interesting because second opinions are something I think people know the term, but they don't really understand them and why they should do them. And I think head and neck cancer is a good way to get into it, because if you could kind of fill us in on head and neck cancer is very complicated in terms of diagnosing and treating, right? So tell us a little about that and why it is.
Yeah, the head and neck area is a very complex area. If you think about it, it hosts several vital functions: speech, swallowing, sight, taste, smell. So the 5 traditional senses are contained within the head and neck. Cancers are relatively rare as opposed to breast, lung, prostate. We're only comprise about 4% of all the cancers in the body. And there are some areas, for example, you mentioned the skull base, that is about 4% of that. So we're talking about rare conditions that are very complex, contains, again, vital functions, and that their treatment also may have some consequences over those. So overall, we are talking about a fairly complicated process to get the diagnosis and get the right treatment, and a treatment that fits the patient needs.
Now, when you say skull base, if I get this right from talking to others, head and neck cancers are not brain cancers, but it's everything else below the brain in the head.
That is correct.
Into the throat.
That is correct. So the skull base is kind of a no man's land in between the neurosurgery territory and the traditional head and neck surgeon territory. So it is where basically the floor of the brain is the roof of the nose and the sinuses and the roof of the eye. So that area that is in between the two, that requires expertise by not only one surgeon, but 2 surgeons at the same time, the neurosurgeon and the head and neck surgeon.
Wow, and you are a head and neck surgeon, and these are very complicated surgeries because you want to get all the cancer on the margins, but leave people with speech, swallowing, smell. I mean, that's the difficulty.
Yes, and so all the treatment that we have that usually requires a multidisciplinary expertise. Our treatments usually doesn't just comprise surgery. It's usually a combination of therapies, and that can be chemotherapy, can be radiation therapy. Nowadays we have immunotherapy and targeted therapy. So the more complex the cancer is, usually the more complex the treatment is going to be.
Yes, definitely. So when you have a patient with head and neck cancer, and kind of walk us through the steps of how you decide with the patient and their caregivers and with your team at the James how to proceed and come up with a plan.
Yes, so usually you have 3 pillars to obtain a diagnosis. You're going to have a physical examination that usually requires endoscopies of the nose or the throat or whichever area is affected. Then you need a biopsy
Right.
And you need imaging. So obviously the imaging is going to be like your map. So once you have those three components, then we have a discussion with the patient about possibilities, maybe possible alternatives. Then we take all the information to a tumor board. A tumor board is you can think of it as a committee where you have members of all the different specialties that deal with the head and neck cancer. So you have not only the surgeon, but you also have the radiation oncologist, the medical oncologist, you have the pathologist, the radiologist, and speech pathologists, and social workers, nutritionists, everybody that has to deal with the treatment of that patient is in that room at the time. And they give their opinion. And that opinion may turn into one or more alternatives that are they taken back to the patient, are discussed with the patients.
Before we get to that, this concept of the tumor board and the committee, I just think that's so beneficial to the patient. It doesn't happen everywhere, but at a comprehensive cancer center in a big hospital like the James, you are an expert, but you're combining your expertise with 10, 12, 15 other experts.
Correct. And not only our expertise, but our different perspectives.
Yeah.
So we try, again, by the combination of those, you try to come up with the best treatment for that patient. Once all that is discussed, the end result of the discussion is taken back to the patient.
Right.
Because the patient is the ultimate the decision maker. And it may be that all these alternatives may be great, but they do not fit the needs of the patient. And we were talking about that a little bit before, is that, for example, it may be that your ultimate goal is to cure the patient, but the consequences of that treatment doesn't fit into what the patient wants. It may be that, yes, they do not accept the consequences of the treatment. Some of these treatments are intense, and it may require some type of tube, at least temporarily, for a period of time. It may be, for example, that the patient wants to get to his or her daughter's wedding. That is in 3 months from now. So all that has to be taken into account. And then the patient will ultimately make a decision with the particular physician that they're seeing, and that's what is followed. So many times, most of the time, it aligns with the tumor board decision, but sometimes it doesn't.
Wow, I never thought of that particularly with these complicated types of head and neck cancer where there's going to be some significant surgery and radiation, that people have important, difficult decisions to make, and everyone sees their own life and future differently, and you've got to respect that.
That is correct. Every treatment that we have certain consequences to it, and the patients have to know about those consequences and really see how they see themselves within the spectrum of different alternatives of treatment.
So at this point, it sounds like when you've made your diagnosis, you've gone through the tumor board, you've come up with a plan, you've presented it to the patient, and they've agreed this is what we're going to do. Would this be the time for a patient to seek a second opinion?
I think that's the point where you decide to go for a second opinion. So it's rare that you get out of that conversation completely sure that you're doing the right thing, or that they're recommending the right thing for you.
Because their mind is just going in a million different directions. Correct. And it's hard for them to even hear what you're saying.
I don't expect it to remember more than 50% of what we discussed. And we're always open to a second time, so if they have questions. But at that time, I also recommend that if they are unsure and they want to seek alternatives that we may not be recommended at that time, to seek a second opinion. And the second opinion could be because, again, is an incredibly rare condition, and nobody is actually sure on how to treat it. It may be that the alternatives that I'm recommending don't align with the priorities of the patient. It may be that it's a logistics type of thing. Well, doc, I really like what you're saying, but I cannot afford to move here for a period of time. I live very far away. I need to get a second opinion closer by. There are a million reasons to get a second opinion, all of which are correct. If you have any question, if you want to make sure that the decisions that you are taking, that can be life-changing decisions, are correct, a second opinion is in order.
Okay, that was a great intro and start, and we're going to take a quick break, and when we come back, we're going to really dive down even deeper into sort of the ways in which you can ask for and find a second opinion.
Yes.
The best outcomes for treating cancer come from early detection and early diagnosis.
The James Cancer Diagnostic Center at Ohio State
is designed to provide rapid evaluation and a clear diagnosis.
We are transforming care by giving patients direct access
to cancer experts who study and treat cancer every day.
If you think you have cancer, the choice is clear.
Choose the James Cancer Diagnostic Center.
We're back talking about second opinions, and I really liked what you said in the first half, that when you talk to patients and lay out what you and the tumor board have come up with for a plan for them, you say recommend that they get a second opinion. And that leads me to think that as a large, really good comprehensive cancer center and cancer hospital, do you get automatically a lot of second opinions and people who just come here to be diagnosed and to find out if what the smaller hospital may have diagnosed is correct?
Yeah, it's not automatic, but we get a lot of people that come for a second opinion. And some of our patients go elsewhere for a second opinion. And the reason that I mentioned it before is that patients many times think that I'm going to be offended if they ask for a second opinion. Right. And it shouldn't be that way.
Yes.
So I see the patient and I have a partnership where we're in that partnership to achieve the best outcome possible. And I need to know about what they want and what they have, and then I offer the alternatives and listen to them what they have to say. But in general, because we serve a relatively large population, and because we are a comprehensive cancer center with all the specialties and subspecialties that pertain to the treatment of cancer, we get people from the communities, and we get people from other comprehensive cancer centers and from even international, that they are seeking a second opinion for this or that reason.
I'd like that you said that you wouldn't be offended, because I think that might be a big hurdle for people when they're talking to their oncologist, cancer doctor, that this person, this man or woman, is the expert. Who am I to question them? They're going to get angry at me. And that should not be the case.
It should not be the case. I suppose that we have different personalities, and like anybody else, we're humans, and some people may get offended by it. But for the most part, in modern medicine, especially in the cancer world, we're very used to second opinions, and it's a two-way street. I give second opinions for my patients, and I send some patients for second opinion too.
Well, good. I'm glad you said that. You send people for second opinion.
Yes.
If someone, meets with their doctor, they talk to him, they like him, but they want a second opinion, what would that person do not knowing who the other experts are out there?
So sometimes we guide them.
Okay.
If they want, I ask them, hey, do you want some possible references, or do you want to do it on your own? And some people, most people, I would say, are really grateful for the guidance. So we have other great institutions around us. We have great institutions in the U.S., and depends on the pathology. It may be that they have very good experts there. And there are people that I know, people that I trust, people that I have seen their results, et cetera, et cetera. And I may guide them to a specific institution or a specific physician. Sometimes neither one of us are sure where to go.
That's interesting because you, being a world-class head and neck cancer surgeon, at conferences where you've given papers, where you've heard other people give papers, you meet the other top people, create relationships, and have people that you respect, and that's who you go to, and they'll go to you.
Correct.
So you create this network all around the country.
Yes.
Of experts you can go to for a second opinion. Wow.
Yes, we have different professional societies. We meet once a year after so many years of attending these meetings. You know more or less who has interest on this or that pathology, and you learn who are the most respected authorities in this pathology or that pathology, and you can refer the patient to them.
So my mom was diagnosed with cancer 5 years ago, and she lives in the Philadelphia area and was getting treated there. And I did go to a couple of her appointments with doctors, and I said to one of her doctors, I work at the James and know a specialist in this area. I'm going to have him get a second opinion. And they sent all her medical records there, and they got this doctor here looked through them, and they did a Zoom meeting since she was far away, and he concurred that what they were doing was the right thing. And that was a great relief for all of us. That
Correct.
The two experts say this is the right way.
Yes. It's a big weight off your shoulders. All of a sudden, this is stuff that you don't understand.
Yes.
Because most lay people don't understand what is happening to them. Right. They don't know why it happens. Yes, we give them the treatments, but they really don't understand what is coming with that treatment. And then you get a second opinion and they confirm that that's the best thing. It's a great relief. You go with more confidence, with more trust. And that's why I like the second opinions. If they decided to go elsewhere, that's what it was best for them. If they decide to come back to me, they come back with that added trust that what I'm doing is the right thing for them.
What happens when someone goes and gets a second opinion, and the opinion is that, yes, what you and your team are doing is one way to treat this patient, but I like this other way?
Yes, and that's not that uncommon. Again, because teams have different philosophies, different policies,
and
different
cancer treatment
opinions.
Is a bit of an art form still.
Different biases. So it's becoming more and more objective, but this is still many conditions that have that the treatments are what we call empirical, which means that you don't have enough data to tell you that the best treatment for this tumor is this. Why? Because some of the cancers we treat are so rare that you cannot ever get enough data. So we treat it on the basis of similar tumors that respond to certain treatment, or we treat it using our judgment. And by the way, that's always transparent to the patient when that is happening. So it may be that you get a second opinion and it's completely different recommendation than what you had. Again, we don't take that personal. We tell the patient why we are recommended what we have, why the other treatment may or may not be as good, and sometimes it's a better alternative. There are some places that may have treatments that are experimental, that are not. Yes, they have clinical trials that are not available anywhere else.
Or vice versa.
Yes, correct. So that is actually very common. We get people at the James because they want to participate in the clinical trial that no one else has. Or we have sent people to NIH or to MD Anderson or to Cleveland Clinic because they have a specific treatment for this very rare tumor that is new. And it may be that the patient is at the end of the rope. That's the last hope that they may have.
So the thing I'm taking away from this is that you never let ego get in the way of what's best for your patient, and that you have a network of other docs here and around the country for second opinions that have that same philosophy, and that results in the patient having the peace of mind and the opportunity to make what they consider the best choices for themselves.
Yeah, ego should never be the driver of the decision making.
And it doesn't seem to be.
Yes.
Ricardo, that was a great overview on second opinions and why they're important, how people can ask their doctors about them and get them. Now, the next step, the James has gone to the next step and created an online second opinion cancer program. So, and I know it's pretty new. So fill us in on what it is and how it works.
That is correct, Steve. The James have always had a program where we can give second opinions. What is new is we have a platform and a structure and a formal team to take care of this. So the patients go through the process in a much more smooth way. It's much more user-friendly. That way the patients can get online and request a second opinion. They can provide the information, and in conjunction with their doctors, local doctors, then we can provide that second opinion in a way that it flows better toward the patient.
Give us an example of perhaps maybe one you've done, so kind of how it worked through the online process, how they connected with you, and then how you connected with that patient to give them their second opinion.
Yeah, I'll give you a couple. One, we have a patient from Costa Rica, and they had this. It was a pediatric patient, and he had a special tumor, and they were seeking for expertise. So as we talked about before, you can get the second opinion because you have something that is rare. Maybe the local doctors cannot give you the degree of expertise that you're looking for. It may be that you're looking for trust. You just want to confirm that what they have told you is
Right.
the best treatment for that. Or basically you're looking for alternative treatments. So in this particular case, it was a little bit of everything. They were looking to see what we could do. They were looking to look for treatments that were less invasive that had been proposed before, and we were able through that second opinion provide that information to the parents through their local physician, and that way they took the decision later on to come to the James and had treatment here. Recently, I had another patient, also from South America, that was having inflammation or swelling of the saliva glands, and they had a variety of tests that they have gone through and a variety of opinions that they have gone through. And again, I provided that second opinion of what they were what the patient was going through, and the possible diagnosis and possible treatments, and that's still in process.
That you're still working with them to figure out
Correct.
what to do.
Correct.
Wow, that's fascinating because perhaps in Costa Rica and in this South American country, they don't quite have the facilities and expertise you have. So you're able to share your expertise around the world.
That is correct. Yes.
So that's really fascinating that you're able to help people all around the world. So if anyone listening to this anywhere around the world for any type of cancer wants to connect with a James expert, how do they find that website and connect?
Well, is part of the website at the James. We have a portal where the patients can start the process. Usually, we're going to provide that opinion through their local physician, and it will be so it's a little bit more smooth, and it kind of bypasses some of the legalities and the ethical considerations when we're giving a second opinion. So they provide the information that is necessary for whichever physician to provide that second opinion. And again, through their local physician, then that second opinion is coordinated. The information is reviewed, and a report is provided to the physician, and then is provided to the patient, and they take it from there.
So it's not a coincidence that you and others here at the James are getting these second opinion requests from around the world. What makes the Comprehensive Cancer Center and the James such a good place and such a well-known place that people reach out to you to get these second opinions?
So when you look at the name of the James is a comprehensive cancer center.
Yes.
So that has a lot of implications that it may not be completely apparent to the patient. It just sounds like a great name, right? But what that means is that you have a series of specialists that are dedicated to a particular kind of cancer. We have service lines that really participate only in the particular tumor. So, for example, the head and neck service line, all our medical oncologists, our radiation oncologists, the surgeons, the only thing they do is treat head and neck cancer. That's a little bit different from going to a hospital where you have a generalist. And not to say that they will not provide good care, but it is a little bit different. When you come to a comprehensive cancer center, these people will have a large volume. They will be treated that translates into a lot of experience and into a lot of data where they have refined their treatments and their expertise to that particular area. And I think that is very difficult to get in any other type of hospital.
And with a rare cancer, such as head and neck cancer, you see a pretty high number of cases because people come from all over. So that means the expertise is centralized here.
That's correct, yes.
Wow. So I agree. And I know that research has found that outcomes for patients are better when they're treated at comprehensive cancer centers / cancer hospitals.
So it's good that you mentioned research. The other thing that you will find is that you will find clinical trials of either experimental or even a standard treatment that are used in a different way that you may not find elsewhere.
Wow. So my final question, I always like to see what motivates people, and I think I can already tell the way you talk about your interaction with patients that patients might be something that's really important to you.
They are. I mean, it sounds like a cliche, but the reason I went to medical school is to take care of people. I see medicine still with all the things that changes that we have seen, all the regulations, all the issues with insurance companies and everything else. The main interaction is still patient and physician, and it is a positive interaction. When I'm able to provide care for the patients, they do better, their family do better, and I feel good about it. It gives me fulfillment, it gives me purpose in life. So at the end of the day, that interaction is really valuable.
Yes, I agree, and I appreciate the way you take care of your patients.
Thank you so much.
This podcast is brought to you by the Ohio State University Comprehensive Cancer Center, Arthur G. James Cancer Hospital, and Richard J. Solove Research Institute. For more information, check out our website, cancer.osu.edu.